Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. You look so beautiful today as usual.
Thank you. I'm wearing my Nolan Miller watch. Do you love it?
It is very telling.
Oh, I think that's a prelude to a joke coming on.
But first,
let's
give out the phone number. I need some callers. You guys ready to call me up and stump me about your orthopedic musculoskeletal pain? If you're shy, don't use your name. Make up a name or tell me it's about your mom or dad or your friend. We want to hear from you right now. And the phone number to talk to us live is 866-870-5752. I'll repeat it for you. It's 866-870-5752. If you call me up, I'm going to mail you out for free a copy of my book. I'm even going to pay the postage, which is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'm holding that up to the camera so people can see it. I'm flashing through the 200 pages or so and the 250 or so studies. That's right, scientific studies on how regenerative medicine works, why stem cells and platelets are the new rage, how they work to grow tissue back instead of you going to surgery to cut tissue out or getting medicated with things like anti-inflammatories or cortisone shots or narcotics to cover up the pain. We don't do that. We do the natural thing, which is to stimulate the body to heal itself. And I've been doing this work for 25 years. I learned it when I was a resident at UCLA. Don't worry, I went to USC too, and a lot of other schools. So, Nita, what else do you have to say about all this?
Well, I think we should talk to Desiree.
Well, that's quick. All right, Desiree, Dr. Marc Darrow, how are you today?
Hi, Dr. Darrow. Thank you for taking my call.
Well, thank you for calling in.
So, I had an acute injury of my left knee about 22 months ago, and I completely ruptured my ACL and tore my medial meniscus.
Okay.
I opted for no surgery, and I did the physical therapy route, and I did Pilates, and I rehabilitated my knee very nicely. I would say at least 90%, and I'm back to doing CrossFit, which is my exercise of choice.
Good for you. How old are you, Desiree?
I'm 55.
Okay, good for you. Okay. And what question do you have?
So I'm just wondering that, I don't have 100% full range of motion. I'm very, very close, but I do feel it. It hurts if I, get to a certain point. So it does hinder me in some things that I try to do. And I'm just wondering, with your therapy, and I know you're not, you can't tell unless you're seeing me, but is it possible to get 100% full range of motion back?
Sure it is, of course. Anything's possible, but there's no promise. In medicine, there's no promise from anybody. And
this long later, almost...
Yeah, it doesn't matter. Yeah, you'd have to work at it. I had, unfortunately, a shoulder surgery back when I was in medical school that I never should have had. And that was stiff also, like your knee. And I was able to stretch it out all the way. I injected myself with stem cells and platelets, which helps. Part of the issue with decrease in range of motion can be that there's still some pain left from the injury itself. But you have a lot of other issues to talk about here. And one of them is you had an ACL rupture. Did you know that because there was laxity in the knee? You could pull the tibia away from the femur, or was it because there was an MRI?
Oh, I had an MRI.
Okay, so let's talk about that, because that's one of the most important things I can talk about on this radio show. The MRI can show you things that aren't real for several reasons. Number one, they can overestimate what's there. They're overly sensitive. They can show things there that aren't there. So I've had several patients who have gotten MRIs that show ACL tears, that's the anterior cruciate ligament tear, and then they want to get surgery, and the surgeon goes in and he sees a complete ligament there, and he closes the person back up. So just because you saw that or someone said they saw that on MRI doesn't mean that's true, okay? That's number one.
Okay.
Number two, even if it is a true ACL rupture, which does happen frequently, my goodness, that doesn't mean you have to have a surgery, and you didn't get a surgery, which to me is smart. And there's only been, so far in my practice of over 25 years, only one person with an ACL rupture that I actually sent for surgery. All the others we've healed up. And this was a guy who was the top surfer on the planet, and I didn't want him taking a chance, mainly psychologically. I wanted him to feel that he was very secure surfing. Now, no one thinks about this, but it's true. When you're surfing a giant wave, you're literally flying through the air. You're not on the wave. You drop in sometimes when it's a big wave, and that's a huge stress on the knee. And he was nervous about him dropping in and the knee collapsing. And I said, I can help you get better, but if you psychologically think that you're going to be damaged, then I think you need to get an ACL repair, which he did do and felt happy about that. So a lot of what I do has to do with the patient, not about me. It's all this stuff is elective. The patient gets to decide what's going on, if you understand. But the first thing I do with an ACL rupture, if it really is one, I look with the ultrasound and I see if there's fluid. If there's fluid, I drain it out immediately under ultrasound guidance so I can get every drop out. If the fluid comes out and it's red, then we consider that it was a tear. If it comes out and it's yellow, which is normal fluid, there's no ripping of a ligament or anything, then they didn't have that.
I'm sorry. And would you still find fluid like almost 2 years later?
Oh, sure. You could find fluid 2 years later. There's a lot of people that don't even have injuries that have fluid. They can have arthritis, just constant wearing and tearing. The whole body is worn and torn. You're 55 years old. What do you think you've been doing to it all these years? You do CrossFit. You know what I mean? CrossFit's rough. That's like gymnastics. I was a gymnast up until I was about 40-something, and my body has been beat up. I've injected most of my body myself with stem cells and platelets, and I'm real functional. I'm going to go out and play golf today, probably take a run, and do some weightlifting. So I'm in good shape. I did have a surgery on my shoulder when I was in medical school that made it worse, and I was dumb at the time, meaning I was uneducated. But since then, when I was at UCLA, I learned how to do regenerative medicine, and platelets and stem cells, I think, are the magic of orthopedic medicine today. I don't let people get operated on. They can if they want to, but I always tell them, if you're my father or you're my best friend or my twin, I'm not going to let you do it. But some of them do it anyway, and some come out okay. But then in the long run, the question is, did it work? And a lot of these people, let's say with knees, will get a surgery. And when an ACL repair is done, what at the same time is done is a lot of other tissue is taken out, and it destabilizes the joint. And then years later, things can go down the tubes. So, there's a good chance that after a surgery, things go bad, and then what's left? Another surgery. So, and then what's after that? A knee replacement, which I'm not fond of at all. I have too many patients come in with knee replacements to see me where the knee doesn't even move. And then sometimes you get people that can hardly move it, but they can move it a little, and you hear the crunching going on of the plastic or the bone on bone of the fake stuff. the metal that's in there. So I'm not a fan of surgery. I tell everyone who comes in who's saying, should I get surgery? I'm going to generally say no. I've only sent a handful of people to surgery in 25 years, and most of the other people we've gotten better since then. So the deal with your knee being not full range of motion, the way to handle that would be come in and get some injections, grow back the tissue that is worn, and stimulate some new tissue growth, and then get yourself a situation where you can put the knee into very warm water with Epsom salt, and then stretch it. Okay?
Oh, that's what I did in the beginning when I first had.
Yeah, but that's what you got to do, that's what you got to do every day if you want your range of motion. Yeah.
Yeah, I did. I didn't even know. I just kind of intuitively, I was in so much pain and I couldn't bend my knee and I couldn't straighten my knee, so I would take Epsom salt baths because it relieves my pain.
Yeah.
Temporarily, anyway.
And it may be kind of difficult to get your whole body into really hot water. I do it with my hands. My hands get stiff from injecting all day and playing golf and playing music. So every day of the week and the weekends, I stick my hands into a salad bowl, which I put in my sink, big salad bowl, and I put in really hot water with Epsom salt, and I soak them and I loosen them up. And I will probably have to do that the rest of my life. I'm not going to quit because it worked one day. And I can function,
Wow.
I can do, I don't give up on my body. And I'm 74 years old, I'm 20 years older than you are. And I'm still doing CrossFit stuff. I have a bar in the back of my yard, and I'm hanging on it and doing all kinds of stuff. So
Awesome.
it is awesome. You never have to quit, I don't do all the stuff I did in gymnastics when I was young. I was doing flyaways and stalder shoots and pirouettes on the bar, flying through the air. I don't do all that, but I'm still on the bar. And, good thing about the bar is you can do a lot of things on that you really can't do with your feet on the ground. So I know in CrossFit you do a lot of bar work, so that's great. But anyway, I think there's a very amazing chance that you can get that knee back to 100%. And putting some stem cells in them, I think, would be a great thing to do for you. And then doing these other things I'm talking about. All right, Desiree? I want to get to Alexandra here.
Thanks for your call, Desiree.
God bless you. Thank you for calling in. I'm going to give out the phone number to talk to me live right now. If you do call in, I'm going to send you a free copy of my book.
Yeah.
Pretty heavy book. It's $25 I sell it for. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's got a couple hundred pages of all kinds of situations that I work on. I work on the whole body, not just the knees, not just the hips, shoulders, toes, feet, arthritis all over. Who's talking in the background? Is that Alexandra?
Yes, hi.
Okay, Alexandra, hang with me. I'm finishing up. I'm going to get right to you. And for calling in right now, you're going to get a free copy of this book. It's got 250 or so studies on how stem cells and platelets work. We call it regenerative medicine now. In the old days, we called it prolotherapy because we proliferate new tissue to grow. So the phone number to call me right now, you'll get in after Alexandra, after we finish up with her, is write this down. Get your pencil, get your paper. 866-870-5752. I'm going to give it out again, 866-870-5752. And if you want to just call the office and get information we didn't talk about on the show, the number to my office, you can call and ask all kinds of questions, is 800-300-9300. That's 800-300-9300. And if you are shy, I hope you're not, and you don't want to call, you go right to the website. I'm going to give that out in a second. Every page on the website has a spot to email me personally, and I answer every single email. I get emails all day, all night from all over the world, and I answer every single one of them. And the website is www.lastemcells.com. That's www.lastemcells.com. I am a communicator, as my patients will tell you. Every single patient gets my cell phone number and my personal email address, and I love my patients, and I love the work that I do, and I'm so grateful that this work has been given to me, I might say, and it's been a godsend to me on my body, which I've beaten up to a pulp over the years doing sports. I'm still doing sports like crazy, and guess what? I still inject myself with platelets and stem cells every once in a while. I haven't had to for a little bit, but if I get injured today, guess what I'm going to do later tonight? I'm going to run down to the office and inject myself. So this is something that can help your musculoskeletal pain all over the body. So, Alexandra, thank you so much for being patient. You're down in Newport Beach. You have a friend that has Ehlers-Danlos syndrome, right? Can stem cells help? Depends what the problem is. Is the person just lax in their ligaments, or are they having pain?
Both, but I just wanted to know what your thought is on the effectiveness of that on someone with EDS, if you know.
Yeah, I get it all. I treat it all the time. It's very effective, 100% effective.
Yeah, because he plays soccer, has a lot of pain in his knees, ankles,
Sure.
heel, and so he does go get injections. And I just wanted to know if you think it's effective, if you think there's anything else he can be doing for that, because he's different than the average person who doesn't have EDS. So that's what my question was.
He is and he isn't. It's still the same issues. In his situation is collagen, if it's truly a situation of EDS, because a lot of people can have EDS, but they don't really have the symptoms that go with it. So there's all kinds of EDS. There's probably 10 million types of it, okay? It's not all the same. Is this friend of yours got dislocating knees?
No, he's more just hypermobile, I think he'd be categorized.
Well, there's a lot of people that don't have EDS that are hypermobile. Do you see what I'm saying? And,
right, his ligaments stretch.
Okay, but there's a lot of people whose ligaments stretch that don't have EDS. That's what I'm saying. This is not a one type thing. And yes, we can help that. I help tons of people with EDS. I get a lot of people that have it that get constant shoulder dislocations, and we can grow back enough tissue and enough collagen and ligaments to tighten them up. So we can stop the dislocations that way. I treat the whole body, as I said before. And, if you're playing soccer, that's a pretty ballistic sport, and a lot of people have pain and laxity from soccer without having EDS, and we help them too. So
Right.
The answer to that is the same answer I give to every single person. I've got to see them and examine them and see what the real problem is and find what the pain generator is. And if you want to write this down, you can give this to him. The phone number to my office is 800-300-9300. That's 800-300-9300. And he can call in and set an appointment. It'll take me 1 minute, literally 1 minute, to examine him, to tell him what's going on. And then if he wants to email me personally, he can just go to my website, which is www.lastemcells.com, and he can email me from that site, and I'll call him up, or I'll get a hold of him, okay?
Okay, thank you so much. So he'll definitely be emailing you then.
Yeah, I mean, is he still playing soccer?
Yeah, he plays once a week, and then he does go get stem cell, injections and does PT and things after that.
Okay,
Prolo.
well, that's good. Okay. Well, he's doing the right stuff. Make sure the doctor who does it uses an ultrasound to inject with, so the solution of the stem cells goes exactly to where the pain's being generated from. And tell him that doing these procedures of regenerative medicine, platelets and stem cells, is not a one-shot deal for some people. And if you're a couch potato, it might be one time. But if you're going out there and you're a weekend warrior like this guy is, he keeps beating himself up. He may have to continue doing treatments. He might, if he's like me and he's beating himself up all the time, he may do these treatments the rest of his life.
Right, he will be.
Yeah, I'm not going to quit.
Exactly, that's what he says too.
Yeah, I'm not going to quit just because I hurt myself.
Okay, thank you so much for your advice.
Yeah, one of my greatest addictions is sports. And if there's a day that goes by where I'm not doing something sports-wise, to be honest, I'm not happy. And I meditate an hour a day. That's another kind of a sport that helps me be happy. But my body has a yearning for exercise and stressing it out. I'm just that guy. I was like that since I was a tiny little boy. Instead of walking anywhere, I would run. And I'm still the same way. It's very funny. I was at I had to return my iPhone last night, and there's a big window, and all the guys in there were watching me run across the street to my car. And I was kind of laughing because I don't want to walk. I want to run. I want to move. And so I'm very fortunate that I fell into a profession that I can help myself with. It's really exciting to do my work. It's the most fun thing I can do, is to inject someone and stop them from having a surgery and get them better with just a simple injection of platelets and or stem cells. Anyway, Alexandra, God bless you, and make sure that the doctor that your friend sees is doing this all day, every day. Otherwise, it's not worth anything.
Thank you, Alexandra, for your call. And would you like to give the phone number as we go to John?
Yes, John, you hang right there. And Ty and Arthur, we're going to get right to you. So the phone number to the studio, Talk to Me Live, is 866-870-5752, 866-870-5752. If you want to make an appointment, call the office. There are people there, 800-300-9300. If you want to email me, go to my website, www.lastemcells.com. So, John, we're going to go to you. You have an MCL. Tell me about it. How long ago?
About 3 months ago, I was in Costa Rica surfing, and I had in a surf line, and I had a driftwood log hit me in the knee, and it partially tore my MCL. And it's been, the doctor said it'll regenerate on its own when I went in to see the orthopedic, but I don't seem like, I can walk, but I cannot go past 90 degrees on my leg.
Okay. So number one, when you have a driftwood log hit you while you're surfing and you have an MCL injury, it could be a tear or just a kind of a stretching, those often do not heal, okay? I know doctors say they do, but when I look with an ultrasound and the patient says, the doctor said it healed, I asked, did the doctor look with an ultrasound? They go, no, they just told me that. So I look with an ultrasound, and very often we'll see some fluid underlying that ligament. And by the way, for those of you that don't know what that is, MCL is the medial collateral ligament. It's in the middle of the knee, and it hooks the two bones together, the femur and the tibia. And it keeps the knee from stretching the wrong way. So I was hit by my dog, Dakota, who's 85 pounds. He was running full speed. We were at the dog park, and I didn't see him coming. He hit me on the outside of my left knee, on the lateral side, and the medial side opened up, and my ACL was stretched, my medial collateral ligament was torn, and my meniscus was torn, okay? All three at one time. That's called O'Donoghue's terrible triad. And back in the old days, they would allow football players to roll into the lateral side of the knee to bust up that knee. That's illegal now, okay? But it was a way of taking that guy's knee out. And that log may have taken your knee out a lot more than you think it did. So I would have to look with the ultrasound, stretch your knee out, and I am betting you anything there's more damage in your knee than just the MCL.
Okay.
And there's a good chance there's some fluid in it too, which we would aspirate under ultrasound guidance. Very simple procedure. We just numb up that area into the joint capsule. We're looking with an ultrasound the whole time. We use a tiny needle. We numb it up, and then we put in a larger needle to aspirate out the fluid. Hopefully it's not blood, and it's just synovial yellow clear fluid. Hang with us, will you? Because we're going to go to a break, John, and then we're going to get to Ty after that. So this is Dr. Marc Darrow. We're on Living Pain Free, and call me live right here now at the studio, 866-870-5752, or call the office, 800-300-9300. God bless you all, and hang with us. We're going to the break.
We'll be right back after these messages.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.